start with describing what comorbidity is, because it's a little bit technical term. Some people
absolutely. Literally, comorbidity means a disease that tugs along, right? A disease that hitchhikes with another disease. That's what comorbidity means. Essentially, if there is one disease process, and then if very often you find another disease process that goes with it or is attached to it, we call it a comorbidity, essentially. And of course, we are talking about morbid obesity today. And the fact that we are addressing comorbidity really goes to the heart of our current definition of obesity, right? Obesity is no longer an appearance issue, an issue of, how I look or what kind of clothes am I going to wear. It goes way beyond that. It is actually a medical condition. And it's a medical condition not just by itself, but it's actually connected to many other illnesses that pop up once a person reaches a certain weight. And as we've said many times, what is obesity? What is morbid obesity? Well, it is defined by the weight of the person. If the weight of the person really goes up by about 100 pounds over their ideal body weight, that person's weight now has reached the level of morbid obesity or clinically severe obesity. And as we've said before, sometimes as healthcare workers, we define this by BMI or body mass index, which many people may be familiar with. And BMI really is another expression of the severity of the weight, because what we do is we take the weight of the person and the height of the person, and we have a formula that puts these two together to give us a BMI, the body mass index. So we know, for instance, there is a normal body mass index associated with a healthy weight that happens to be anywhere between 18 to 25. So if your doctor calculates your body mass index and say, hey, your body mass index is 24, it means you have a very healthy weight, right? On the other hand, if the body mass index goes up between 25 and 30, we talk about the person being overweight. If it's 30 to 35, we talk about the patient having class 1 obesity. If it goes between 35 to 40 now, we talk about class 2 obesity. And then when it's over 40, then obviously it's the most severe type of obesity. We call that morbid obesity. And as it happens, morbid obesity is also the level of obesity that qualifies a person to have surgery to address obesity with a surgical treatment.